Kính thưa quý vị, chào mừng quý vị trở lại với chương trình VOR On Air do tổ chức Vietnamese American Roundtable VOR thực hiện. Buổi ghi âm ngày hôm nay đó thưa quý vị, chúng tôi sẽ nói chuyện bằng tiếng Anh và chúng tôi sẽ nói chuyện về chủ đề sức khỏe cộng đồng. Trong tương lai thưa quý vị thì Nguyên sẽ cố gắng mời một người nói tiếng Việt để mà tản mạn cùng với quý vị về chủ đề này nhé. Chủ đề sức khỏe cộng đồng là chủ đề rất là quan trọng đối với chúng ta. Nhưng mà ngày hôm nay thì chắc chủ đề của chúng ta sẽ nói bằng tiếng Anh không thôi. Xin quý vị thông cảm cho. Hello panelists, thank you for being part of today's discussion regarding the barriers to accessing healthcare. I have met and gotten to know all of you, but instead of having me reading off the bios, I'd love to go around the Zoom room here and have you introduce yourself, your name, which organizations you're with, and please tell the listeners what has inspired you to advocate for the underserved community to be able to access healthcare services. I will start with Claudia, but before I do so, Claudia, I just want to say that I do know your family. Your children are excellent, smart, and kind. They will make this world a better place. Their father is my mentor, and he is the reason why I am who I am today. I really care so much about him and really love him. But surprisingly, for the past 7, 8 years, I don't think I've met you. So it was so great to meet you last year, Claudia. And if you can share with the listeners a bit more about yourself and why are you doing what you do now?
Absolutely. First of all, I want to start by thanking all of you for your invitation to have this very important discussion. My name is Claudia Rossi. I became a nurse in the 1990s, and I venture to guess that perhaps it was before some of my fellow panelists were born that I was going to nursing school. And my motivation to become a nurse came from my experiences as a child living in a community that didn't have any resources and witnessing really the suffering that arises from lack of access to healthcare. The fact that there are mothers and fathers and grandmothers and grandfathers that passed away far too early because of preventable conditions like diabetes, hypertension, heart disease. The cost that we bear in underserved communities is far too high. And I am inspired every day by my patients. I work for a federally qualified healthcare clinic by the name of Bay Area Community Health, well, where I work side by side with members of all kinds of communities. I have Vietnamese colleagues, and we go out to the community to do health screenings and to connect underserved families to the services of our clinic. So I'll share more as we go along, but I hope you know how truly honored I am to be with all of you today. What a way to start the year.
Exactly. Happy New Year too to you and everybody here.
Thank you.
I'll pass it on to Emily Wong.
Hi everyone, my name is Emily. I'm a community organizer with the California Nurses Association. And yeah, I'm currently on the nurses campaign to win CalCare and Medicare for All. I've actually been in the social justice field for like the past 4 to 5 years. And I actually got politicized through organizing on a mental health campaign when I was a youth. So I'm very excited to be sharing space with other young folks who are also working on mental health. And yeah, like my own experience navigating the healthcare system during COVID has inspired me to advocate for health justice. Health is something that every single person has, even before you're born, like you have health. So everybody, no matter the identities you hold, like you will have to interact with the healthcare system. And I'm just very honored to be working on this campaign with the California Nurses Association.
Thank you, Emily. I will pass it on to Megan and Tiana, who are the VAR's intern who are very, very, very skilled and very great with what they do. But then they also have their own inspiration to why they wanted to work on health equity and racial equity projects.
I can start. Hello everyone. I'm Megan, and I'm a social justice and racial equity intern with VAR. Whenever there's a social justice topic to be discussed, I feel very eager to show up, and VAR has been a great channel for that. After listening to Claudia and Emily speak at the Community Health Dialogue at Tully Library, I was very inspired with their work, especially in specific areas and realms of social justice, health advocacy, and policy advocacy that I've never heard about. So that's why I'm very excited and honored to have them here today.
Hello, everyone. I'm Tiana. I'm also a VAR intern, and I'm super excited to become more informed about healthcare and barriers in this discussion with you all tonight. Working with VAR has helped me, I'm sorry, I'm not as eloquent as you all, but I've been able to reach out to underserved communities, and I actually have an upcoming project called the VAR Street Outreach Team, where we're working to advocate for underserved and underrepresented communities. And I look forward to hearing what you all have to say on the topics of healthcare and its barriers tonight.
Thank you, you guys. Okay, so just for the uninformed people like myself, right, because I missed your presentation, can you, Emily or Claudia, can you elaborate a little bit more on the barriers to health services, and then what your patients' experience is like, or like the hefty costs of utilizing the healthcare services? And then that's one. And then do you also see the trends of people, entering homelessness due to the inability to pay for their healthcare services? And then community members who are forced to work past their retirement age just so that they can afford their healthcare.
Thank you so much for the question. And I worry that there's a perception out there that with Covered California and with some of the healthcare reforms that we have all been familiar with over the last 2 decades, that there might be a sense that, well, the problem is kind of solved. In reality, over 3.2 million people in California still remain uninsured. One of the problems as well is that health insurance coverage is tied to employment. And so I don't know how many of you know people who have lost their employment and who then have to go about finding out how much it costs to have healthcare coverage. And so the crisis that I see is that because people can't access healthcare because of the price of healthcare, they go a very long time without getting preventive care, without getting early diagnosis of different conditions that, if addressed early on, can be remedied. And so the tragedy of life and vigor and productivity and joy that is lost when you can't afford to see your doctor periodically to find out early if you're pre-diabetic, to find out early if you have a small lump in your breast that can be addressed early on. So the price of a healthcare system where we have executives in the healthcare industry that are collecting exorbitant bonuses, the system where hospitals that are privately managed decide to close down maternal child departments, whether or not the community needs it, that it's a system that is driven by profit instead of the public good. The price that we're all paying for that is too high. And Emily, I'll turn it over to you, but that as an RN, as a woman of color, as someone who works closely with underserved communities, I am fed up. I am fed up with the status quo.
Yeah, definitely agree with everything that you've said, Claudia. There are so many things wrong with our current healthcare system. And usually when we're talking about CalCare, we first really go over the five like overarching problems with our healthcare system. The first is that there isn't universal healthcare. Not everyone in the state of California has insurance. And even when people do have insurance, many are actually underinsured. So what this means is that even when you have insurance, you can't afford to use it because of the high costs of the copay, the deductibles, and the premiums. And then second, there are like all sorts of like terms that make navigating the healthcare system very confusing. There's PPO, HMO, Medicare Part A, Medicare Part B, and Part D. There's Medicaid, there's Medi-Cal. There's also like the bronze, silver, gold, and platinum plans on the ACA exchanges. It's just very difficult to know exactly what kind of care you're going to get, what's covered, and how much you will have to pay. And yeah, some people have this choice of what insurance to get, and navigating can be just almost impossible. Other people just have no choice at all. And then third, when you have insurance, it may not even cover dental, vision, hearing, or long-term care. So it's not comprehensive in its benefits. And then fourth, in conjunction with that, when you have insurance, you are limited to certain doctors and hospitals in a given area. So that is your in-network services. But if you were to go out of that area, out of this network, then your medical costs will be even higher because your insurance doesn't cover it. And so lastly, this is just like our healthcare system is just way too expensive. In fact, medical debt is actually the #1 reason why people go into debt at all in the United States. People have had to give up their homes, their houses, and apartments like while trying to pay off these medical bills. And this becomes even more frustrating when you compare the United States with other countries in the world. So the United States actually spends nearly twice as much per capita on healthcare as compared to the next highest spending countries, many of which who already have single payer systems that cover all people. So yeah, our current healthcare system is just not designed to deliver care in ways that benefits patients. Nurses experience this on a daily basis when they're unable to provide services to their patients because their patients have been denied through their insurance to cover that care. Because oftentimes insurance only covers like a certain percentage, if at all. And so because of that, people usually end up paying like hundreds of thousands of dollars for care or just like skipping care altogether. This prevents people from getting preventative care services. This also means that people will wait to the last minute until things get really bad with their health, and then they go to the emergency room, and then the bill is actually even higher than if you were actually to receive like preventative care. We definitely see this happen a lot in low income and communities of color. So and I also want to share that COVID has really like exacerbated this issue. Recalling from like my personal experience when the COVID lockdown happened, my mom became unemployed and she lost her health benefits, and I was a dependent at that time, and so I also lost my health insurance. And so the alternative to that was to have my family pay for COBRA, which allows my mom to maintain her current healthcare plan from her employer. But there's a catch. You have to pay an $800 premium each month. And on top of that, to keep me on that plan was another $800. So that is $1,600 a month for healthcare for someone who was unemployed. What happened was my mom ended up paying for COBRA while I opted for Covered California. And I just remember struggling a lot to understand like what are all these plans? What is the difference between bronze, silver, and gold? Like, what is a deductible? What's a premium? I was just so confused by the healthcare system, and it just made me think a lot about all the immigrant families who also don't have English as their first language. It's very difficult for our communities to navigate this healthcare system. And yeah, to like circle back to your question about being forced to work past retirement, my mom is an example of this. Even though she's not physically well to do her job, she still pushes herself to work so that she can have the health insurance that her job provides. And yeah, she's even more so aware now that if she stops working, that she won't have health care.
And add to that, the tyranny of the pharmaceutical industry, the cost of prescription drugs. And I think we could all identify with members of our family who go without much needed pharmaceuticals because of the cost. And so one of the features of CalCare that as an RN, I am most excited about is the fact that that single payer system and really the democracy of having CalCare means that that tyranny of the exorbitant price of pharmaceuticals will no longer be possible. There's right now the pharmaceutical industry is free to charge whatever they want. And that negotiating power that we would have under CalCare would really benefit all communities, truly.
Thank you both for your input. Not trying to put Megan and Tiana on the spot here, but you guys are the future. I'm trying. I feel like I'm trapping you guys into this conversation because you guys gonna help us solve this problem. But Megan, Tiana, any reaction from your end as a young adult? I think if I do the math right, it's like you guys have 45 years away from your retirement. So you have 45 years to help us solve this problem, Tiana and Megan. Any reaction at all to what Emmeline and Claudia was sharing?
For me, I think it's such a depressing topic, but that's something that most like young activists forget, that a lot of our elderly or anyone who's just not the young population who have to actively deal with this are going through this in real time. And I think you guys need the young population, the young movement of activists to also join in. So as I'm educating myself on this, I feel very passionate about the topic. I'm like learning that this is one more issue that we have to all work towards. And I've seen it too, because like I'm close to my neighbors, and when I talked to them for the first time, they revealed to me that like they haven't been able to see a dentist in 10 years. And although dental care isn't like, oh, it's not like the primary care, I guess, but it is very like strange to see that so many people can't access it because as from a privileged point of view. And so I did have a question, but maybe Tiana, you want to like put in any of your thoughts first?
Yeah, thank you, Megan. I completely agree with you that the young population will definitely play a role. Thanks, Nguyen, for the timeline and the deadline. But I'm just like absorbing all the information, and it's like making me realize that some of the things you guys brought up that I never really noticed, like prescription prices and pharmacies. Like whenever I go to the doctor, I have like slight arthritis in my joints. So I have a rheumatologist I go to. Sorry to get a little bit personal, but whenever she asks me like, oh, which pharmacy do you go to? I'm like, oh, the one closest to my house. And she's like, oh, that one's not covered by your insurance. Or I noticed like when my parents go to the pharmacy, I went with my mom once, and the lady there, she was like, wow, your insurance like really covers like nothing for you. Like you still have to pay these really hefty prices. And it's just, yeah, like Megan said, it's like really depressing to think about. But yeah, Megan, you can continue with your question.
I think that yeah, thanks Tiana. That's something like it's really depressing, but it's something that like we all have to kind of focus on now. And I'm sorry about your arthritis. But I know that Nguyen was gonna ask about what solutions you guys perceive, and I think CalCare is obviously one of them, and we're pushing for that now. I wanted to ask about like what sort of developments you guys know is like happening as we speak in like the activist movement in this area. anything that we can like look forward to? Anything we should... Sorry.
Yeah, so before I go into like CalCare updates, I think I should share a little bit more about what CalCare is. And so yeah, CalCare is a single payer system. So right now, what we have is a fragmented for-profit system that really does just line the pockets of insurance, pharmaceutical, and hospital corporations. The current system we have is set up to really maximize the profits for these big insurance companies who constantly deny medically necessary care and just add on a bunch of administrative costs to the system. Roughly $1 in $3 that we spend on healthcare in the United States actually goes towards administrative costs. And yeah, like as we've already been talking about, we pay the highest prices in the world for pharmaceutical drugs. I remember something that I learned over the summer was that insulin, the people who are like in charge of insulin, they were able to mark up insulin by 5,000%, just because they could, because they are a private business. And yeah, this is something that is very concerning because many people rely on insulin, you know, to live. So yeah, CalCare definitely would like tackle this issue and like negotiating like pharmaceutical drugs. But yeah, like our current healthcare system really like creates a lot of financial and unnecessary bloat that really prevents people from actually receiving care. And yeah, CalCare is the best solution that we have to address this crisis. So we have 7 core principles in the program. So the first one is universal coverage, meaning that everybody in, nobody out. Every resident of California will be able to receive healthcare regardless of race, sex, gender, country of origin, disability status, immigration status, marital status, age, and income. Second, CalCare is a single public program that is publicly funded through progressive taxation to cover all necessary care in California. So this really tackles the bloat and the waste from the system that we currently have, and will actually save people thousands of dollars in healthcare costs. Third, CalCare will have a fully comprehensive benefits that includes medical, dental, vision, mental health, hearing, prescription drugs, long-term care, and more. The decisions on the care that you will need will be made by you and your doctor. So no insurance will be telling you like, no, we can't cover this. And then fourth, you have the freedom to choose your care provider. So this way you don't have to worry about being in network or out of network for doctors or hospitals. Fifth, it is free at the point of service. So no more copays, premiums, or deductibles. You arrive at the doctor's office, show them your CalCare card, and you just get the care you need. And sixth, there will be a just transition for workers who may be displaced from the insurance industry, whether this looks like early retirement, tuition payments, or priority hiring in the CalCare system. And lastly, patient care is based on patient need. So yeah, there will be no more financial incentive to avoid providing necessary care, and we will no longer allow insurance to determine what we need. So yeah, these are the 7 core principles of CalCare that our community and nurses believe will solve the systemic barriers to our healthcare system. And making sure that we have a single payer system is the most effective way to alleviate the systemic barriers that our communities face when accessing this healthcare system. I did want to like connect this back to like the previous question as well on working past retirement to afford healthcare. So this is also something that CalCare tackles. It will de-link employment and healthcare. So we've actually had one of our nurses share with us that a family member of theirs had passed away while waiting for their employment's healthcare to start covering them. And this is very unjust, and this should not have happened at all. Like no one should have their healthcare denied because of their employment status. And so CalCare will make it so that receiving healthcare is not dependent on your employment status. I know I've been talking for a while, but I also must share that like most jobs provide healthcare coverage as a result of unions and workers organizing. So workers and unions have fought for and continue to fight for their health benefits. And I want to share that implementing CalCare is not undermining any of the work that unions and workers have done to improve their healthcare benefits, but rather it would build worker power, because most of the time, like employers will try to threaten their workers by taking away their healthcare benefits. And so if CalCare is implemented, then that kind of like removes that threat from the employers. And it would actually even expand the healthcare benefits that healthcare coverage that workers will get, that everyone will get. And yeah, moving on to the updates. For those who are listening and feel empowered to support CalCare, we are reintroducing the CalCare bill before the February 16th deadline of the 2024 legislative session. We are having our most active volunteers organize legislative visits towards the end of January to make sure that the assembly members of California know that CalCare is widely supported by Californians. And yeah, for folks who want to get involved and volunteer, you can sign the petition in our Linktree. So our Linktree has the petition along with other general information about CalCare, such as like FAQs and also about financing. Our Linktree is Linktree/CalCare_campaign. So just to spell that out, that is linktr.ee/CalCampaign. And yeah, you're also welcome to check out our website at nationalnursesunited.org/CalCare.
Awesome. Thank you.
Emily, that was amazing. That was truly amazing. There is one, and I made a note of this in preparation for today's dialogue. It says that CalCare would prioritize the allocation of funds to projects that would improve healthcare services and address structural healthcare inequities for underserved communities. And I mentioned that to kind of put in a plug for something that I, as an RN, think it's imperative. We need to build the pipeline of healthcare providers to include communities like the Vietnamese community, because there are so many people that finally a grandmother or grandfather make their way to a doctor's office, but there's a language barrier. Or there may be another barrier that I think is very intimidating to so many who don't come from this country, who come from other cultures. And it's to feel that your healthcare provider doesn't respect you, or doesn't understand you, or is condescending and doesn't understand your challenges, your beliefs. And so when you enter a room and you feel on any level that somebody is condescending or doesn't understand your reality and your values, how likely are you to entrust your health, your physical or mental health, to that healthcare professional? So one of the things that I would like to see under this reform of our healthcare system is investment to assist more young people so they could go into the field to become that therapist, to become that doctor, that healthcare provider, so that when our families finally make their way to that doctor's office or that therapist's office, that they could find somebody that comes from the community. And it's something that I think in looking at our healthcare system, to be misunderstood as a patient by your healthcare provider, or to feel judged or misunderstood. And I know I use that a lot, that term of being misunderstood, disrespected. It's very alienating. And so I think one of the projects that I'd like to see CalCare funding undertake is to encourage more young people like yourselves to consider the healthcare industry to better serve the needs of our community.
Thank you so much, Emily and Claudia. Megan, do you have any reaction, any comments that you may have?
I I just wanted to say thank you because you guys have crammed so much information into this short conversation that's also being broadcasted. So that takes a lot of skill and your effort and time. So thank you about that. And I learned a lot, especially your bit at the end, Claudia. It was, I think, really well spoken. My grandmother is always having troubles with finding someone who understands her at a healthcare level. And yeah, like I sometimes can't understand because she comes from another language, but I wish she could be and get that care she deserves. But yeah, that's what I wanted to say. Thank you.
Thank you, Megan. Thank you.
I'd also like to add that just being able to talk with two incredibly empowering women, especially women of color, I'm just always super I just feel I always feel inspired whenever I'm seeing people of my gender, of my background, and I don't know, it's just really makes me feel like I can make a change in the future as well. And
Awesome. Yeah.
yeah.
Absolutely, Canning. I have some notes here. I'm gonna say this very quickly. The Vietnamese community, San Jose is home to the largest Vietnamese community outside of Vietnam. Wow. And so imagine if that power, that number can be used to advocate for something like CalCare, right? There's strength in numbers. And one of the things, and I want to, be careful how I word this because I have colleagues that are from Vietnam, and in having conversations over lunch or when we're just too tired, and when you're so tired, you'll say anything that comes out of your, anything that comes out of your mouth. You're not editing because you're so exhausted, right? And I remember a colleague from Vietnam said, in the Vietnamese culture, we place the good of our families above our own individual interest. We honor our elders, we honor our ancestors, and we think first, what is good for the family before we think what is good for just me. And so I think that those beautiful characteristics of the Vietnamese culture can be something that could be harnessed to support something like CalCare. And I have a lot of hope when I see these spaces to activate our communities, because the injustices are that in the Vietnamese community is overrepresented when we're looking at the mortality rates for heart disease, for diabetes, for strokes, for cervical cancer, for lung cancer. These are all things that are, if not preventable, easily treated more successfully if addressed early. And so I have a lot of hope to see all of you here. And I just think activating our families around this issue is really hope affirming for me as a nurse.
Thank you all for the conversation. Just to take away, while Tiana and Megan may have 44 to 45 years of life before their retirement, I myself have 28 years. So tell me now what I can do to support your effort, Emily and Claudia.
Yeah, just start off by signing the petition, and then we'll definitely be sending you updates as we go with the campaign. We do have a lot of exciting things lined up. So yeah.
And I would just say politically, anytime you have an opportunity to attend candidate forums, ask the question, where do you stand on CalCare? And make your voices known and ask that question, because it's also about holding people who are running to represent our interests accountable. If you have the opportunity to attend a candidate forum for your next assembly representative or on any level, please ask, where do you stand on CalCare? And then tell your friends, register your friends to vote so that they are voting for those that will champion reforms like CalCare. We have so much power that we haven't fully realized, and it's time.
Awesome. Thank you so much, you all, for today's conversation. We will come back again with another Vietnamese language segment just like this to talk more about childcare. But with that, I would like to say goodbye to the VAR listeners. And thank you so much, Megan, Tiana, Emily, and Claudia, for the conversation.
Thank you. Thank you.
Yeah.
Thank you. Happy New Year.
Thanks so much for having us.
Bye-bye.